Okay, first of all, I would just like to tell you all how honored I am to be here today. This is my first time participating in the patient portion of the meeting, and I just am so motivated by listening to your stories, seeing your coping strategies, and how you support each other. And it is amazing, and I do thank Kathy Brewer and the ECD Global Alliance for this opportunity. My topic is ECD and exercise. And when I first saw the topic, I'll be honest with you, it's a tall order. Because first of all, a lot of people in the general population, even when they're well, don't like to exercise. So now I'm going to try to convince people that have an illness that they need to do this, especially with the range of functions that patients have with ECD. I have some patients that didn't even know they were ill. ECD was discovered incidentally on other screening for other problems. And I have some patients that can't walk. And so that is a big spectrum of patients to try to come up with a plan for exercise. So let's take a look at what we're going to talk about today. My objectives for today are, number one, to define exercise. Secondly, discuss how to initiate an exercise program. And lastly, to look at guidelines that every exercise program should have. So first of all, both caregivers and patients, how many people in this room exercise currently? That's not bad. That's not bad. Out of those people that raised their hand, how many of those people are the caregivers? Okay. So we do have some patients that are already in exercise programs. That's excellent. So the first thing we really need to establish is, how do you define exercise? And I have some images up here, and there's a whole assortment ranging from formal weight training to going for a walk in the woods, to biking, swimming, gardening, activities in the home just to try to maintain your home can be viewed as exercise. And then I'm sure no one in here is a server, but that picture's to represent, some people say, well, in my job, I'm quite active. So if you Google exercise, you come up with a couple categories here. You have physical activity, which includes activities of daily life, pleasure walking, occupational things, household chores, and then energy expenditure that burns calories. When you Google the word exercise, these things on the right come up: brisk walking, treadmill, cycling, weight training, swimming, and jumping rope are examples that are listed. So when I looked at this list, the first thing I said is, wait a second, energy expenditure that burns calories, wait a second, all these things on this side burn calories, don't they? So what does this mean in terms of what exercise is? So I would like to propose, for the purpose of this lecture, that we're going to call exercise a subset of physical activity, with the difference being exercise is going to be planned with regularly scheduled intervals. Everyone's a little bit different, so you may not be a morning person, but you might have a little bit more energy at night, or vice versa. Or maybe at lunchtime is your best time because you're stiff when you wake up in the morning, but you're a little bit stronger in the middle of the day, but at night you're exhausted. So it's going to have a regular scheduled interval. It's going to be structured, meaning there's going to be a prescribed amount of time with a set amount of repetition. And we're going to look a little bit further in the lecture about what that means and how you get started with that, because that's the biggest challenge. I think you have people that are wheelchair bound, people that have some other problems with sight or sensory problems that may limit where they start. Or you may have the patient that says, I'm not really that symptomatic and I golf 3 times a week. So there's a big range there. And then finally, this exercise program needs to be goal-oriented. We need to have objectives on improving or maintaining physical fitness. Now, I've been talking to a couple people that saw the topic about the idea of goals, and I think it is important to realize that we need both short-term goals and long-term goals. And we'll look at some of that, how you establish it. But goals can be changed as well. If you set a goal and you've overshot that goal, you can't get discouraged if you have to back down on your short-term goals, with still keeping the long-term goal in mind of maintaining physical fitness or even improving strength. So how do we get started with an exercise plan? And I really wanted to include this slide early on in the talk because I do think there is only the very, very rare patient that can't exercise at all. It's very, very uncommon to not be able to do something in terms of exercise. But I do think that first you need to discuss exercise plan with your healthcare provider, whether it's a physician or nurse practitioner. And the main reason is to establish your cardiovascular and pulmonary health. Is it safe for you to exercise? And I do think that does need to be established because we're trying to do good, not harm here. That's a very important point. So then we get to what do we do next? How do we go about it? There's several ways to go about it. You can go to a licensed physical therapist. Many physical therapists now, I don't know about in Europe, but in the United States, are independent in their practice. In other words, they don't even require a physician's prescription anymore. Now, I've had some physical therapists say that certain insurance companies do want that still to ensure payment on the plan, but it's not always even needed anymore. A second way is a certified sports medicine exercise physiologist. You could join a gym and work with a personal trainer. And once a routine is established and you're working out at home, if that's your preference, the internet can even be helpful once you get a program established. Now, I think my personal opinion is if you're a patient that does not have an exercise program in place or you've never exercised, I think the best start is a physical therapy consult or a certified sports medicine exercise physiologist to do a really good assessment of your strength and the ability where you are at your start point so that you can have safe recommendations that aren't going to cause injury and that they can help you set some realistic goals. Once you have had that consult, I think it's easy to move to some cheaper ways to work out and have an exercise plan if money is an issue for you. And many physical therapists are quite willing to collaborate with a personal trainer. In fact, we heard that last night when you were describing, Alice, your workout schedule. She works with several of these folks together for her plan of care. So if you look at the literature, there is a whole host of benefits to exercise. Now, I wasn't going to read all of these. Anyone in here right now that has problems with sight? There are. So let me run through them real quickly then for those that are primarily listening. Exercise can improve circulation, assist with weight control, improve cholesterol levels, hypertension, prevent bone loss. It can boost energy levels. And I think the list on the right is really pertinent to ECD population. Although the ones on the left are important, the ones on the right are very helpful to ECD patients. Releasing tension, improving insomnia or sleep disturbances, improving your self-image, help to manage stress in your life. It counters anxiety and depression. We know that exercise releases those happier hormones in the brain and also increases strength. Many of you are feeling weak. So those are all important. So now we say, what about ECD data and exercise? Well, I'm sure you're all shocked at this slide that there is no data on ECD and exercise. So does that mean that we can't come up with a plan for ECD patients? One of the things that I did when I realized this was my topic is I consulted with the physical therapy department at Johns Hopkins. I'm a nurse practitioner, and although exercise is a part of my care with my patients, I really wanted to talk to them about their ideas about ECD and exercise. So the gentleman that I spoke to, he said, you know, I've never even heard of this disease. Like you've heard that before, right? And so he says, but next week I'm presenting, we have these topics and we present to our whole team, and I would love to present this disease and see what they come up with. So I was delighted. I said, that would be great. So I sent him some articles. Of course, he had looked at the old data, which wasn't so promising, and a little baffled that I was trying to come up with a plan for patients that was long-term. And then I gave him the more current literature, and he met. And they came up with the fact that even though there's no specific data for ECD, we can borrow information from chronic pain patients and their data with exercise, cancer patients and their data with exercise, myositis, which is inflammatory muscle conditions and that data, and also chronic fatigue, and pull some of those things together and apply them to ECD, which I think is really important. Especially these two in the center here, cancer and myositis, because in these disorders, exercise has actually been shown to decrease inflammation. And that is very helpful in conjunction with your medication and your other plan of care. So goals specific for the ECD patient. I think the first thing most of you would say is, I want to preserve the function that I have now. I mean, I may want to get better, but I definitely want to prevent further deconditioning. I don't want to get worse. That's the first goal. Secondly, gain strength and stamina is always helpful so that you can do more of what you want to do. Help prevent, improve depression, and elevate mood. I think anytime there is a chronic illness, it's very easy to get down, frustrated with your situation. You're not where you want to be. We heard a lot of that from Dr. Robertson. I think anything we can do to elevate our mood and get some positive thinking is going to be very helpful. And then lastly, what I had mentioned about decreasing inflammation. Some considerations for you folks that will be important is that you may have initial fatigue. If you haven't been exercising and you're going to start an exercise program, some of you are tired already a lot of the time. You may have a little bit of fatigue, and our goal is to avoid exhaustion. We're going to talk about how we set those initial guidelines to avoid exhaustion. Secondly, we have to look at medications and the side effects from the medications. They definitely contribute not just to your disease symptoms, but to how well you'll be able to exercise. And the disease symptoms are definitely going to affect your choice of exercise. If you're in a wheelchair, you're probably not going to be choosing the bike to warm up. You may have to, some physical therapy locations and some gyms have some arm devices that are almost like ellipticals for the arms to warm up the muscles. You're going to focus on other body parts that you do have some function in to start your exercise program. So back to that first slide when I was showing you physical activity versus exercise, I do think exercise can include familiar activities. Walking is a great form of exercise. It's a good way to warm your body up, and it's enjoyable. You're going to want to do things that you like. So as long as you have the goals, the intervals, and the duration of time you're going to do those activities, I do think they can be considered exercise and work that into your program. You're going to want to start at low levels. And lastly, don't get discouraged. it's easy to get discouraged if you're not meeting the goals that you have set for yourself. You may make tremendous advances in your exercise plan and then not feel well for a whole week or 2 weeks, and then just, you have to know you may need to start back a couple steps and start again. It's a process. It's not something that is going to necessarily be easy. Other considerations to the whole concept of exercise are costs, and we can't ignore that. There are some costs associated with an exercise program. Your time and energy is a cost. Cost of equipment if working out at home. Now, I brought some things along with me. And on your handout last year, I looked at the handout, and it focused, I wanted to do something a little different. How many people were here last year? Okay. So a lot of those exercises focused on balance, gait, and at least what I saw. I wasn't here for the lecture. These bands, I looked online. Some of them are $2.99. You can't get cheaper than that. You can buy sets, and they are graded based on color to amount of resistance. And the reason I like the bands is, number one, they're cheap. Secondly, even my sons that are outstanding athletes use these bands as part of their workout for resistance and very specific muscle exercises. And it works on not just strengthening the muscles, but you can also incorporate some of the exercises that simultaneously work on balance. And you can do it at home, any time of day. Stick one of these in your pocket or your purse. These are a very, very good resource if you just want to get started at home with even 5 minutes a day would be a good start. You can get things even something like this is less than $20, and it can be hooked around a door frame, hooked on a chair to work upper body. You can loop it around and still work legs. So this would be a perfect example of an inexpensive way to get started. There's also gym membership fees if you want to go with the gym. And then a lot of you have a lot of experience with the cost of insurance. And co-pays for physical therapy, that can get a little pricier. So next we look at exercise and medications. So you have your medications for your ECD to contend with. Then you may have, just because you have ECD doesn't mean you don't have additional medical problems that are coexisting with that disease. So your list might be pretty long with other medications that you take. And medications can have mixed effects. For example, your ECD may be better with vemurafenib, but you may have some joint pain related to that same treatment, which can affect some of your exercise. Beta blockers can make you a little more tired, but beta blockers might improve your heart function to improve exercise. So it can go both ways with medications. So components of an exercise program. You're going to have a warm-up. The warm-up is to basically get your body moving and warm up your muscles. It can just be walking around your house. If you're in a wheelchair, wheeling around a little bit. But the purpose of the warm-up is to loosen up your muscles and get your body moving. The second component of an exercise program is strength, resistance, and cardiovascular training. And research has showed that these things combined together are most beneficial. And then lastly, the cool down and stretching. And stretching, I was talking to Alice earlier about this. Stretching is most helpful because what it does is, the best benefit is it increases your range of motion so that when you have better range of motion and you're doing your workout, you can get better muscle effects. And it's best to do the stretching. Sometimes you'll see runners doing these fancy stretching, ahead of time. But for this population, I really think the warm-up should just be gentle movements to just warm up your body. So the initial assessment guide for an exercise program is used by physical therapists is usually to first start out establishing your resistance strength. So they will do an evaluation of the patient, and I don't mean to exclude the whole cardiopulmonary evaluation because that's crucial, but for the purpose of this lecture, it's very complex and we probably won't have time to get into that. But looking at the resistance weight component of your workout, you want to establish your strength. So a physical therapist does an assessment and they look at what your 1 repetition max is in terms of how much weight you can actually do one time. Then they look at your 10 repetition max weight, doing very good form. How much weight can you use doing 10 reps of that particular exercise? And then looking at that weight, they cut that back by 50%, and that is your starting point for your exercise strengthening portion. Because they want your workout to, on a scale of 0 to 10 being the hardest activity you can ever do, they want you to start at about a 5 so that when you're done, you feel that you've worked out, but the next day you're really not exhausted or you're not terribly sore in your muscles. So that's a good rule of thumb. Continued assessment of the exercise plan. A healthy non-ECD population may advance their exercises every 4 to 6 weeks, make an increase in the weight. For the ECD patient, it could take longer. It could take 12 to 16 weeks. And so you need to be patient with that slow progression. The strengthening is range specific, and it is better to use really good form with a lower weight than to try to, powerfully increase weight and not work on this good range of motion of the body. There's also some other things that you can use in conjunction, like massage therapy. It can often help with the muscles, and using heat and cold does have a place in your workout as well. A couple more tips for your workout. The intensity, duration, and frequency do matter. So let's say you don't feel well one day, or even for a few days in a row. It would be better for you to work out for 15 minutes several times throughout the week than to say, well, I was really busy this week, and then do tons of working out on the weekend. The muscles respond much better if you have smaller, shorter intervals of exercise than to have that power weekend, so to speak. And I think the more variety of exercises that you can develop, the more interesting it will be for you. It's very easy to get bored with the same things. So you can have sets of exercise plans that you can change up a little bit that work similar muscle groups and have the same muscle resistance goals, but just change the activities. And I think you can't use enough motivational tactics. Utilize distractions if they help. Earlier in the very early morning session, someone mentioned music. Really good music that you enjoy can help distract you from exercise if you find it boring. The other thing is most people watch the news. They can utilize that time to stick a band around the leg of a chair or hold on to the edge of the chair and do some leg exercises, or incorporate that into normal daily activities that you do find interesting to help. And then additionally, record the workout details. I think journaling your workout is very helpful for you to track what you've been able to accomplish. And it really boosts your mood to be able to see even small gains, whereas you may not see that if you're not paying close attention. And it can also let you see when you've become a little stagnant or maybe having a harder time doing a certain exercise, so that you can step back and reassess your goals a little. You may need to back down on the workout. I do think you need to be cautious to avoid exhaustion, and if you're newly diagnosed or you're very sick at certain points in time, the exercise can need to be put on hold briefly until you're feeling better. So in conclusion, and I don't have a clock up here. Are we done? Okay. So in conclusion, I think it is the rare patient that the doctor or care provider is going to say you can't exercise. I think there's some form of exercise for every patient in this room, even if it's starting at very low level. I think the safety needs to be discussed with the healthcare provider, and although the outcomes may be slower, I don't want you to feel discouraged. I think exercise can decrease inflammation, increase strength, and allow you to do more activities in your routine life and really help you to feel good about that. And I would encourage you to get creative in terms of ways to get motivated. One final thing on the handout, if bands are too much for you to use, if using a band in some of those images creates too much resistance, every single one of those exercises can be done without any weight. Some of the exercises could be done in bed even. So, and I'll be happy to stick around a little. If you're having trouble interpreting the diagrams on there. Mm-hmm.